Prostate adenoma, signs, treatments, complications. Benign prostatic hypertrophy or adenoma refers to an abnormal increase in the size of the prostate gland. Frequent in men after 50 years, it causes many symptoms, frequent urge to urinate, pain. Definition. What is a prostate adenoma? Adenoma of the prostate, or benign prostatic hyperplasia, is very common in men after 50 years. It is a benign increase in the volume of this exclusively male gland. This does not necessarily lead to symptoms, but the most common are urination disorders, explains Adam Vardi, urologist in Neuilly sur Seine. All men can be concerned, but the risk increases with age, specifies the doctor. As a reminder, the prostate is a gland located under the bladder and whose main function is to secrete a liquid that contributes to the fluidity of sperm. Prostate cancer. Since the adenoma is not a pre-cancerous state, nor with prostatitis, which is an inflammation of the prostate of infectious origin. Causes. Genetics, age. We don't know the causes of this disease, declares the urologist straight away. There could be a genetic predisposition, as some families are more affected than others, but nothing is certain. In addition, testosterone would play an important role, but we still do not know what mechanisms come into play. It is possible that with age, the prostate becomes more sensitive to hormones. Symptoms. Bleeding, urge to urinate. When the prostate increases in volume, it will put pressure on the bladder and on the urethra. This is why it can lead to symptoms associated with urination, frequent urges to urinate, urgent needs with leaks sometimes, a delay in the initiation of urination, the need to push to start it, a weak and intermittent urinary stream, longer urination. In some men, there may also be a decrease in the strength of ejaculation. Clinical signs. Prostate hypertrophy is diagnosed using rectal examination, which allows the doctor to assess the size and consistency of this gland, and thus detect an abnormal size. Diagnosis, ECBU, PSA. In addition to the digital rectal examination, additional examinations can be added: a urinary cytobacteriological examination ECBU, or a blood test with dosage of the specific prostate antigen or PSA. A urinary tract ultrasound can also be performed to more accurately assess the volume of the prostate. High or low PSA. Prostate-specific antigen blood levels. Prostate-specific antigen PSA is a protein made by the prostate. It helps to thin the sperm and promote the movement of spermatozoa. What is the standard rate? How to interpret its results? Update with Dr. Anne-Christine Della Valle, general practitioner. Treatment: treat a prostate adenoma. Medications. There is no treatment to cure the disease. Nevertheless, the disease can be simply mild and not cause symptoms. This is why, when it is the case, simple monitoring can be offered. But when the patient experiences symptoms that interfere with daily life, drugs can help reduce them. Drug treatment. First-line treatment based on alpha blockers can reduce urinary difficulties, by attacking muscle contractions most responsible for urinary problems. As a second line, we have drugs called 5-alpha reductase inhibitors. They have the effect of deflating the gland, and therefore reducing the symptoms related to prostate compression. Nevertheless, they only work on 1 in 2 patients, and the reduction in prostate volume is not always significant. In addition, side effects may appear in terms of sexuality. Surgery. For Dr. Adam Vardi, surgical treatments may be indicated in special cases, for example, when the symptoms are too severe or there are complications. They can also be requested by the patient if the drug treatments have ended in failure. There are 2 types of intervention: open surgery enucleation, which consists of removing the main part of the prostate, specifies the doctor, and transurethral resection of the prostate. The latter consists of curating the hyperplasic parts of the prostate without making an incision, but by introducing an endoscopic instrument into the urethra as far as the bladder. The most frequent complications are urinary tract infections. Complications. The most common complications are urinary tract infections, explains the urologist. This can cause kidney damage, so this is one of the situations in which to operate. Urinary blockage is also a complication, but rarer, reassures the specialist. Prevention. If it is impossible to avoid prostate hypertrophy, there are nevertheless ways to prevent its aggravation and repercussions. Reduce the intake of drinks in the evening and avoid anything that congests the small pelvis: alcohol, spices, white wines, sedentary lifestyle, long car journeys. Maintaining good physical activity is also essential.